Hello and welcome to today's show. We are going to be talking about the coronavirus, this thing that has received mass attention over the past week, mainly because of our reaction and response to this threat. Now, when this first hit about 2 months ago, I have to admit I was completely unconcerned. I thought it was going to be like any other virus, and our reaction would be like any other virus. But about a week ago, we made the decision, or rather our government made the decision to start these mass isolations and lockdowns and quarantines and shelter in place. And that really concerned me. And so I started looking into why all this was happening. Why was our reaction to this coronavirus so different than everything else that's happened before, whether it was SARS or MERS or Zika or all these other terrible infectious diseases that seem to plague us every couple of years. And after about a week's worth of investigation, I have come to the conclusion that mass isolations are the worst possible reaction we could have had to the coronavirus here in 2020. Now, I know that goes against probably almost everything you've been hearing about the coronavirus on the news from politicians, probably talking with your neighbors, going to the grocery store. Everybody is very, very concerned, more so than they should be, especially about our reaction. So I'm going to today walk you through kind of how pandemics work, what the research says about how you mitigate a pandemic, provide a more pragmatic alternate solution on how we deal with these pandemics in the future, and do a little bit of review on how we got to this place, what factors got us to this place of politicians and media freaking out, what it's going to take for us to get out of this and get back to normal, and then how you should prepare for next time. So, without any further ado, let's talk about some basic definitions you may want to know just in general. So what is a pandemic? It's basically just a virus or disease that spreads all over the world. It could be just on a couple countries, it could be a couple continents. But that's basically what it is, just a virus that spreads globally. Versus an epidemic. An epidemic is something that just is the same type of disease, but just a little bit lower blast radius, which is to say maybe it's just within your country or within a region within your country. But it's just there. It's not multi-country, multi-continent. And then we have something called an endemic. An endemic are things like chickenpox. These are viruses and diseases that are with us for basically forever, but they come and they go. For example, with the chickenpox, you get it when you're young, nobody really dies from it, and you move on. No major disruptions. And one really important piece of information and definition to know is something called NPIs, non-pharmaceutical intervention. These are all the things that we've been doing over the past week to help fight the coronavirus, the invisible enemy, as Trump calls it. And so these are things like social distancing, good hand hygiene, washing your hands, isolating the sick, quarantining people, and then these very invasive home isolations. Basically, an NPI is anything that doesn't involve a drug or vaccine to mitigate and fight a virus or pandemic. Okay, so what are the nature of these pandemics? How do they work? How do they function? Well, they're really not that difficult to understand. And the key part is to know that not all pandemics are the same, right? Some are very severe and need to be dealt with in a severe manner. Others are much more mild. And most of what we've experienced over the past 20, 50 years are fairly mild forms of pandemics or epidemics. And so our reactions have traditionally matched the severity of the virus that were happening. Now keep in mind that even though they happen every 2 years, they don't really get a whole lot of attention, which is probably why you haven't heard about these a lot. You'll there'll be a flare up in the news or the tabloids about something happening in Africa or China or the Middle East, and it happens. A few cases, happen in the United States, and then it dies off, and we're on to the next news cycle. That's not what happened this time. We'll get into that later. Now, keep in mind that when a new virus hits, it doesn't just go away, right? They actually comes typically in waves over 2 or 3 years. So keep in mind when you're hearing a lot of stats over the news about the number of people infected, it's generally happening over 3 years, not necessarily happening all within a 2 or 3 month time frame. So it's a very important thing to know. And then finally, when a pandemic happens, these vaccines take a long time to develop. Generally, the quickest we can turn around a vaccine is within about 18 months. And that's usually because we need about 4 months or more of testing these things out in human trials. Right? Before we give a vaccine to every man, woman, and child in America, we need to make sure that it's safe and it's not going to cause any side effects, right? As part of the Hippocratic Oath, as doctors, we don't want doctors to do more harm than good, right? That's very important. So let's take a look at a previous pandemic, the 1918 Spanish flu H1N1 pandemic. Now, what we're looking at is a chart that shows those waves that we're talking about of it hitting basically, now this is over a 12-month period that this happened to hit, but you can see 2 years, 12 months, and it has these waves of coming up, coming down, coming up, coming down. Not every pandemic is going to be 12 months. Sometimes it's 3 years. If you look at something like SARS that happened between 2003 and 2005, that's a very similar virus to what's happening now. So that's, kind of had this, 2 or 3 year cycle. It mutated, and then about, 15 years later, it kind of came back. And so we really need to give some credit to our great-grandparents, perhaps great-great-grandparents, depending on your age, and say, wow, these people are really strong people to survive, especially given the death toll. And even though you see the scale over here on deaths per 1,000 people, you can really look at it more in percentages. So that really top number is 3%, the bottom number is 1%. So you can see during that 1918 Spanish flu that started in China that it actually was probably around 2.5%, depending on how you want to average out these numbers. So let's take a look at some of the major viruses that we've seen over the past 20 years, right? So we had SARS, and we had this bird flu, and we had the swine flu, and we had MERS, Ebola, Zika, Ebola, and now SARS 2.0, or the coronavirus, whatever you want to call it. And you can see is that 4 of these are basically, came from China, right? The H1N1, the H5N1, the bird flu, and now the SARS-CoV variations. We had one from the Middle East, MERS, and then of course Zika and the Ebolas basically came from Africa. Now keep in mind, the Ebola virus came about 40, 50 years ago, was discovered in Africa, and only recently, last year in 2019, was a suitable vaccine found that we feel very comfortable giving out to a lot of people. So that's a very long lead time. Of course, Ebola is a very complex and deadly virus, so as our medical technology evolved, so was our ability to fight and come up with vaccines. All right, so what are we looking to do whenever we fight a pandemic? What do we consider success in our actions? Well, I think as we alluded to earlier, the biggest thing we want to do is we want to do less harm than good, right? It's that Hippocratic Oath that doctors take. They don't want the cure to be worse than the disease. The second thing we want to make sure is we're fighting this very rapidly, very efficiently, and very effectively. That means our medical community has a fast response. They're supplied with the equipment they need to fight this thing, and that we're taking the necessary precautions to take care of the people that are at risk. And I think anytime there is any sort of emergency that happens or difficult challenge we come across, I think part of our approach needs to be to document and capture anything that we're learning that's really important that we can use for next time, so that when another emergency happens, whether it's a viral emergency or natural disaster or war, terrorist attack, whatever it happens to be, that we're prepared and we know how to respond efficiently and effectively. Okay, so how do we grade these pandemics, right? Because again, like we said, not all pandemics are created equal, and we don't want to treat them or react to them all the same way. So there's a few things we want to pay attention to, right? A few pieces of data, because it's always helpful to look at the numbers and let the numbers influence how we react, right? Let data speak for it. Let's not just make gut reactions, knee-jerk reactions, emotional reactions, but really let's take a look at the impact and the blast radius this type of virus could have on our society. Now, there's a lot of data out there that is something we called vanity metrics. Now, a vanity metric is something that might look good and seem like something important that we should pay attention to, but actually does not inform our response to that particular threat. Okay, so the first thing we really want to look at is the death rate. That is, how many people are going to die from this virus, right? And it's not just a death rate in overall numbers of total population, but we have to break that down into the at-risk people, what percentage of people are getting sick, and of those percentage, what people are dying, and what percentage of those people are hospitalized, right? So you've probably heard a lot about this idea of flattening the curve, and that really speaks to our medical services capacity, right? How many patients can they in a specific region, right? And it's hard to really talk about these in national numbers because each geographic region is going to have a different population density, and a different capacity within that region to deal with those services. So we have to take a look at the hot spots that are happening and the hospitalization that might occur. And like I was saying with the death rate, we have to take a look at our demographics to say, okay, what percentage of our true population is at risk? So even though we say we can take a vanity metric, right? Let's say, okay, well, we think 60% of people are going to get infected with this virus, and then we can say, well, this has a 2% death rate. So we could say, holy crap, that's tens of millions of people potentially that are dying from this virus. Well, no, that's not true, right? It could actually be that we have a 60% infection, but the only people who are really dying are a very subset of our demographics, a really small age range, with a set of pre-existing conditions, right? So those are the type of metrics that we want to look at and focus on because that's really going to inform our response. Now let's take a look again using this idea of certain metrics being important, and let's go back to our 1918 Spanish flu, the H1N1. And let's take a look at this graph that takes a look at the number of deaths by age range during that time period. Okay, so one thing you'll notice with almost all pandemics, and actually this was not true of the current coronavirus, but this is true of the H1N1, which also hit in 2009. Right, so we take a look at this and we say, okay, the elderly are at risk, and generally, sadly, our elderly always need to be taken care of, and we always are saddened by the fact that they get hardest hit by these viruses typically, right? Because they're older, their immune systems are compromised, they have other conditions that are fighting against them to recover from these new viruses that do appear. But what's neat kind of about H1N1 and not so much about the corona is that it really hit the younger demographic really, really hard, right? So you can see we have this huge age range of maybe 15 to 55, and they got a significant hit. And given that tends to be a really large percentage of our population, when we see that group get hit, that's always a pause for concern. Not that the young are more important than the old, but that if that group is at a higher risk, then it's more people being affected potentially by this virus. So again, you have to look at the numbers, you have to look at exactly what the impact is going to have, what's the recovery rate, how do we deal with it, etc., etc. Okay, so with that, let's take a look at what happened with SARS-CoV-2, or the coronavirus, or COVID-19, or the Kung Flu, whatever you want to call this thing. Okay. So this actually started, the first outbreak was in November in Wuhan, China. Doctor first came about it. It's kind of seemed like these almost like a pneumonia, but it wasn't exactly a pneumonia. And so they were, okay, this is a new novel thing that we're dealing with. Let's figure it out. And of course, China had a bit of a cover up, and then finally, after about a month and a half of trying to cover it up, they finally got the WHO involved and said, hey, we got this virus in Wuhan. We don't know what's going on. Can you come, help us out? And so this is what we call a level 5 alert. So the WHO has 6 phases of their pandemic response or rating of a pandemic. And basically, once it gets out of a region and starts to spread, so not just, most of these things kind of start in animals, they make a leap to human, they're kind of within humans a while, and then it figures out how to spread from human to human, not just human to animal. That level 5 human to human, that's when we start getting concerned. That is about the time that China really alerted the WHO, which is a UN organization, and said, hey, come help us out. And so our scientists were able to really quickly identify what this was, right? It was a new novel virus, which they labeled 2019 nCoV. And not soon after, we had our first case in the United States. So about 19 days, about 3 weeks from the first time that the WHO was notified by China that this virus was localized to China, we now have somebody in the U.S. getting sick, and the spread has already happened within a 3-week time frame from China to the U.S. Now you could actually say it's maybe about a 2-month time frame if you go from first infection realization to this, but that's still a really quick spread from WHO notification to it getting out in the U.S. right? And so at that point, that's really in those 3 weeks went from level 5 to level 6 is super quick. There wasn't a whole lot of lead time between that jump, and that's a huge jump. That's like nuclear war is the difference between level 5 and level 6. Okay, and so finally, Wuhan is quarantined, but it was kind of a little bit too late because by that time, 5 million people had come and gone, traveled through and left Wuhan. And that's a lot of people, and that's really how these pandemics happen, is we don't address the viral cause soon enough. We are not transparent. The governments are not transparent in their actions, and a lot of problems happen because of mismanagement of bureaucrats in government. And so then a few days after, about 2 weeks after these first cases in the U.S., the government, Trump specifically, locks down the border with China, which was fantastic, helping stem the tide of infections in the U.S. And then, of course, about 10 days after that, there's these huge New Year's parties, Chinese New Year's parties. It's the year of the rat in San Francisco and New York, 2 areas that have been really hit hard by the virus. Of course, very soon after, in March, maybe about a month after, not soon after, about a month after, the WHO declares this a pandemic. Which, hey, it's great, better late than never, but it seemed like they really kind of dragged their feet on something that should have been obvious about a month or 2 earlier, that this thing was out in the wild and it needed to be contained and dealt with quickly. And then, of course, we have the travel ban, and then we have this quarantine, or not quarantine, but NPIs, these social distancing, reducing of gatherings. And then this past Monday, Trump announces that we're having now, I have to say, National Guard. We're building hospitals in California, Washington, New York, which is fantastic that we have this ability kind of within a week of realizing this is a serious situation. It's something we need to address. They're able to respond with millions of new personal protective equipment and masks and ventilators and new hospital beds for the people in need. And then, of course, after that, we have a $2 trillion stimulus package to help keep our businesses alive, to help keep our workers, which we absolutely need. At the point where we're in mass isolations, we absolutely need that. And hopefully it really doesn't go a whole lot longer than Trump's self-imposed deadline of April 12th. It might, or chances are there's some states that might kind of impose their bans a little bit longer, but at least it won't be, at least there's an opportunity, a potential to get out of this by April 12th and not have this drag on to June, July, or August, which would be just astronomically atrocious. Okay, So now that we've kind of had a very long background on viruses, how they spread, what things to look for, let's take a look at these things called NPIs. So again, NPIs are non-pharmaceutical interventions, basically using everything but drugs to help mitigate the spread of a virus within a population. Social distancing, mass isolations, isolating the sick, hand hygiene, washing your hands, etc. Okay, so when I first heard of these, I thought, oh my gosh, this feels like an extreme response. Why are we doing this? We've never done this before. Is there a good reason for it? Right? And along those lines, well, okay, well, we're isolating to help contain the spread. I get that. That makes sense, that would temporarily stop the spread. But I had a lot of questions like, what happens after we get out of isolation? Won't this just kind of come back again? There's still people that are going to be sick and it's going to rebound, or there's going to be these traces, and kind of like how I went from one person in Seattle to now 30,000 or more people in the United States are infected. Can't that just happen again really, really fast? And also, if we're not doing everything and people are getting laid off and there's this huge economic shutdown, what's the cost? How does that impact not only me, but my neighbors, my family, my friends, people I don't know but still care a lot for? It's going to have impact on hundreds of millions of people financially, right? Not just stock market, but actual effect on them. And so I went, and one of the first, so I went down this rabbit hole, and one of the first pieces of papers that I looked at was this 2017 paper on mitigating the spread of the flu, especially a flu pandemic. And it's interesting. It's a really long read, and you really have to dive down into the evidence section to really get down to the nitty-gritty. And that nitty-gritty, you'll see a lot of just really fascinating papers that it references as reasons for doing certain recommendations in its more high-level version of the paper. And there was also a whole lot of other papers that came out during my last week of research, and papers that had been written within the last month in February by a lot of Chinese scientists and mathematicians on that specific virus, and then a lot of research from the decades prior on learnings from H1N1 and other viruses. Of course, one of those recent papers was the Imperial College paper, which got massive attention because it's saying, okay, we need to be locked down for a long time, right? Because whenever all these lockdowns and quarantines and things were happening, the politicians were saying, oh, it might just be 5 days, it just might be a couple weeks. And this was the first paper that came out that really smacked people in the face to say, hey, listen, guys, this is not going to be over quickly. To really seriously contain this could take up to 18 months. And that really scared people. But I am glad, though, that even though it probably portrayed a really grim picture to a lot of people, it at least portrayed the facts. Instead of our politicians and media kind of giving us information piecemeal, it gave it to us all at once, which was perfect. Okay, so what is the basic learning from NPIs? Basically, they don't work. They're great for temporary restraint, right? So it's kind of like saying, okay, you can go into timeout virus, but as soon as that 5-minute or 10-minute or 3-month-long timeout is done, the virus comes back. And we have to deal with this again. So really the only real effective solution against the virus are pharmaceuticals, whether that's a drug therapy that already works that we can apply to help alleviate symptoms or help alleviate the spread, or a vaccine, which is not going to be coming anytime soon, that helps really prevent the at-risk people, the people with pre-existing conditions, whether it's by age or just your natural DNA that you were born with at no fault of your own, of being at risk. So we're going to go through some quotes that you can see, and this is one of the big ones that came from the learnings of a Chinese scientist from the flu in 2009, the H1N1 flu from 2009, and what they were looking at is said, hey, we did these mass isolations, and they didn't work. The economic harm that was created from these just wasn't worth it. It wasn't worth it. It really kicked our butts, and we should not do these unless it's a last resort. And then again, we're taking a look at another quote here, just basically saying that these social distancing, it's like moderately helpful. It's not this amazing silver bullet that's going to solve all of our problems. And again, social distancing, yes, it's nice, but kind of like the Imperial paper shed light on how NPIs have to be used. That is, they must be used for a long period of time. If we don't do these things for months and months on end, they're really a useless tool. We should really just throw them away unless we're willing to say, hey, we don't mind having people get evicted. We don't mind people losing their jobs for the next 3 to 6 months because we're going to be using these absolutely extreme nuclear methods to solve this crisis. And another one is that you'll see some curves and you'll see them say, hey, we need to use like all these different combinations of NPIs, of social distancing and reducing gatherings, etc., for it to be successful. And that's not always true. Sometimes one single NPI, the right NPI, is more effective than a whole slew of NPIs. So just bear that in mind. And again, all those were from the scientific paper. I'll provide links to it so that you can go and read it for yourself and not just trust what I'm telling you from what I've read on the research. Now, getting to this whole flatten the curve, this just drives me absolutely bonkers insane because it is the most misleading piece of information that we've been hearing, right? Because research is showing, as I've said, we need 6 months of isolations to really have an impact. Anything else doesn't really matter. And again, it's going to take years for us to come up with a vaccine. So what happens is, in this first wave, year one, we have this wave of infections. We all go and hide in our homes, and then we wait, 6 or 7 months, and it comes back, and we have to go back in our homes again. Wait another year, it comes back, go back in our homes, and it just becomes this endless cycle of sticking our head in the sand that's just not going to be effective and sustainable over a long period of time. And as we'll see in a couple graphs, is that the options or the assumptions that it has people make is that there's only one solution, which is mass isolation, which is not correct. And then, of course, the orders of magnitude are generally off. They're usually worst case scenarios that they're preventing, and they're usually squishing everything from saying, instead of this having 3 curves over 3 years, we just have this one squished up curve that has this massive peak of people dying, and look how horrible all this is. So let's take a look at this one. And again, this has absolutely no numbers on it whatsoever, right? It's got this, and it uses red to emphasize how dangerous it is and how much blood and guts it's going to happen, because we need to flatten the curve, right? And so the whole idea of flattening the curve, as you can see, is that it's all about trying to make it so that our medical care capacity, right, the number of hospitals and nurses and equipment matches the need of the particular virus. Right? And so we had this magical curve that says, oh, this is so deadly if we do nothing, but if we do mass isolations, suddenly we're perfectly under the curve, and absolutely nobody that needs to die is going to die from this virus. Right? And this is just a massive lie. And all this does is scares people, it creates panic, and that's the last thing that we should be doing as a country, as a community. That's the last thing that we want out of news organizations and media organizations and politicians. We want to be able to respect and trust them. We don't want to be able to have to do a double take and say, is what they're telling us the truth? But that's what we have to do, because again, we have this long curve here, no numbers. It doesn't show us how long it's going to take. It's just we have this magical silver bullet solution of mass isolation. And then again, you'll notice in any of these curves, none of the medical capacity increases. Medical capacity always stays the same, which is absolutely a lie and absolutely ridiculous. We have the ability to repurpose existing buildings and bring in medical equipment to help the needs of the people who are getting sick. Now, is it going to be up to the high quality of standards that we have on a regular basis? It might not be, but you know what? It'll get the job done. And sometimes getting the job done is better than having to live up to our standards. So for example, these ventilators that are for sale or were for sale cost about $33,000, right? The state of New York back, I think it was 2015, was looking to buy ventilators. They're looking to buy about 16,000 of them, but at 33 grand a pop, that was about $500 million they'd have to spend on ventilators. And Cuomo and the state was like, you know what, the chance of this happening is really low. We don't think we're going to need these anyways. Chances are we'll need even more. So because we'll need even more, there's no point even buying them. Which, it's a scary thing if that's really how it went down. But understandable, right? You've got budgets that you have to manage, and in that instance, we have this imaginary potential with a low probability of happening, or we can spend $500 million on helping our citizens right now. And the politicians were like, yeah, we'll just go with the right now versus preparing ourselves for down the line. And given their purpose, their mission as politicians is to get reelected, that makes perfect sense, right? Their mission isn't to help the people. Their mission is to get reelected. So whatever they did need to do in that particular election cycle to get elected is the decision that's going to override anything else. Okay, so getting back to our graphs, let's take a look at another graph. And this is a graph kind of similar to what you'd see from the Imperial College. You've seen these probably on Medium and other these blog sites of people going and writing these crazy, panicky, scary articles. And they say, okay, yeah, hey, let's take a look at what's going to happen with 3 or 4 different NPIs, and we have to use all of them all at once to get any sort of value, and look, we're going to be great. Now this one's a little bit better because it has a little more realistic curve of saying, at the very bottom here, you can see where it says that our surge capacity is still not going to get met. So it's trying to say, hey, no matter what we do, people are still going to die, which is realistic, right? We don't have that many beds per person because on a day-to-day basis, most of us are healthy, right? I mean, health insurance only works if most of the people are healthy. If most people are sick, health insurance companies don't make any money. So that's kind of how our medical system is set up. It's run by these health providers / health insurance companies. They say, hey, we don't want to spend more money than we need to keep people alive. If this is the average number of people that are needed on a regular basis, let's not build more supply than the demand dictates, right? And they didn't do any planning or preparation to help in a surge moment, whether it's a viral or other type of catastrophe. So the big thing to take a look at this graph is that at the very end, after all these measures in place, we have a nice, happy ending with a bow tied on it, right? The virus is dead, nothing else happens. And of course, as we've seen in prior pandemics, not to compare pandemics because each one's going to be a little bit differently, but in general, again, they come in these waves, and they're going to be a little bit different each time, but they're not just going to die out unless we find a vaccine. Right? Again, the only way to kill these things is to have a vaccine. Short of a vaccine, these things come and go year after year. So we need to understand how we're going to deal with this year over year. And so to do that, to think about how are we going to deal with these pandemics in the future, we need to take a look at something very popular in Silicon Valley called first principles thinking. And what does that mean? That means that we're questioning every assumption that we have. That means we don't take anything at face value. That means we take a look at something and say, well, what is the root of this problem? Let me really understand why and how all this is working. And that's what you really need to do, is start breaking down ideas and concepts into its smallest component and build from there. Right? Don't make assumptions. Don't take people's word for it. Don't assume that bureaucrats and the media have your best intention at heart, because they don't. Right? They're announcing things in a specific way, and if you'll notice, they don't really give a lot of reasons or data or citations behind their decisions. They come out and they just make these decisions, and boom, it happens. And if you look at other countries around the world, you notice how these things slowly roll out. Nobody ever started with saying, hey, we're going to put you in mass quarantine for 3 months. Nobody said that. What did they start with? Oh, well, quarantine for 5 days, quarantine for 2 weeks, quarantine for 4 weeks, quarantine for a couple months, right? So they kind of ease people into the idea of a mass quarantine for a long period of time, because if they did that all at once, people would be like, oh my gosh, this is insane. Why are we doing that? And they would demand answers that, quite frankly, our medical leadership and our politicians didn't want to give. Okay, so that's why it's important for you to break down your knowledge into its small components, build it up from there. Basically, instead of starting out at the leaf of a tree and just kind of eating that nice juicy apple that the news media wants to give you, that politicians want to give you, say, here, eat this apple, it's got all the knowledge you need. No, you need to go all the way down and dig down into the roots of that tree and be like, okay, where is this apple coming from? What are the nutrients? How is this all being brought together to provide this juicy bit of knowledge that I'm consuming, right? And that helps you make better decisions on whether or not you should eat that apple, or you should say, no, I'm not going to trust this. This is actually a rotten, poisonous apple that people are trying to feed me, and I'm going to go have an orange or a pear instead, right? So again, make sure that you're doing all this research on your own, and this is what really helps you develop a unique worldview. Because if you don't, what's going to happen is you're just going to believe anything, you're going to be a lemming, and you're just going to jump off that cliff with everybody else and probably be happy about it. You're probably not even going to be upset that you're filled with misleading information. You're going to be, hey, this is fantastic, this feels good, it tastes good, I'm just going to go with the flow, and the next thing you know, you're in a bad situation and you don't know how to get out of it. Okay, so given that NPIs are a bad solution because they are only a temporary stopgap, and when the virus returns, we have to implement them again, what is a better solution? And it's really a very simple two-step solution. The first one is we take the at-risk group of people and we take care of them, right? So an NPI like isolation of the sick, which we use on a regular basis, would of course happen with this, but also we take our at-risk population. In case of the coronavirus, it's basically 70 plus with one or more, generally multiple, pre-existing conditions, and saying, you know what, why don't you sit this out for a month? We're going to provide you some assistance. We're not just going to leave you out on your own, but we're going to help you with medical care, deliveries, food, etc., to help you sustain and keep a somewhat normal life while we keep you safe. And during that, we're going to be providing, ramping up our medical capacity, right? There's no reason that we can't isolate people who are at the most risk and build up our capacity very, very quickly, so that as hospitalizations and such increase within not just the at-risk but in general population, because those things do occur, that we have the ability to serve and help those in need. So again, very, very simple. And the beauty of this thing is that it doesn't cost trillions of dollars. It costs millions, maybe low billions, depending on what's needed. And that allows us to deal with this in a very effective, efficient manner, right? Because we do have to take a look at the economic impacts of mass isolation. And that's not to say that money is more important to people, because that's absolutely not true. What that's saying is that there are repercussions, there are ripple effects of mass isolations. They don't just happen in a bubble, and in 2 months later, we come out as if nothing happened, right? This isn't like the Thanos snap, where at the very end of Avengers, everybody comes out like nothing happens, and we're going to go and defeat and be victorious, and this is fantastic. That's not how NPIs work. There is harm, right? It's not just like 401k harm, but actual harm that happens to families and people. They're losing their jobs, they're losing their savings, they're losing their home, right? And what's interesting is this pragmatic solution I'm presenting is what we've basically done for the past 50 years. So why we've suddenly chosen to go on this insane, crazy route is absolutely beyond me from the research I've done. The research I've done says that our approach for the past 50 years has worked. Let's stick with it because it's worked, right? And that's not a dogmatic, non-first principle view. That's going down, looking at the research, looking what the scientific papers say, what our mathematical modeling is saying, and all of the papers vehemently, without a doubt, point to the fact that NPIs are not a viable long-term solution. And in fact, unless it's like the Ebola mixed with the flu, where we're spreading this very quickly and everybody is dying, there's absolutely zero reason we should be shutting down the entire country. And in fact, everybody references the Spanish flu 1918 as this huge thing that's happening similar to the coronavirus, but it's not, right? H1N1 happened in 1918. H1N1 happened in 2009. What happened in 2009 in Obama's first year of presidency? Basically nothing, right? Our response was very little. 60 million to 90 million people got infected. 12,000 people died, which is very sad. It's always sad when people die. But we had a very calm, cool, collected response to this virus, and we made it through the other side okay. And we can do that again with future viruses of a similar threat severity level. Right, so with the pragmatic solution, what happens whenever something like the coronavirus hits? Right. Well, first thing we have to acknowledge is that our government agencies have been woefully unprepared. Right, which is really sad, because in response to 9/11, the government went into pass a couple of really nice bills, like for example the hospital response bill that had I think like $300 million dedicated to it up until 2007 when its budget was slashed in half, and the idea was to basically prepare hospitals all over the nation on how to deal with a crisis, right? Whether that's terrorist threat or viral threat, natural catastrophe, and somehow all that money just got spent, and nothing positive seems to have come out of it based on what's happening in 2020. And also, Bush passed a response program on flu and crisis pandemics again to help prepare the nation for these type of events. They stockpiled over 100 million masks, personal protective equipment. What happened is about 4 or 5 years later in 2009, whenever the H1N1 hit, we depleted our national supply reserve of these masks, these N95 masks, and we never replenished that supply. So from 2009 to 2020, we have this 10-11 year gap of our national reserve, kind of like we have a national oil reserve in case things get crazy. We have a national reserve of masks. That got depleted from 100 million down to like 10 million, right? And we just never resupplied those, right? So it's clear that the doctors and bureaucrats and politicians who are running our national and world health organizations have done a poor job and have absolutely failed us. Fortunately, we have the private sector, which is really just individuals, right? The private sector isn't just these mammoth, Goliath, mysterious, cloud-like giants. It's really just individuals stepping up and being innovative, thinking critically on how they can solve the problem at hand, right? And that's what really great leaders do. If you look at a lot of management and leadership theory, the idea is that, that the management, the leaders shouldn't be solving the problems. They're just supposed to propose the problem to their team, and the team then goes and finds the best solution, iterates, and builds what's needed to solve the problem. And the leadership just kind of helps provide some guidance and support and the necessary resources to enable their team to do their job and do it well. So fortunately here in America we have a great private sector. And so here's kind of a funny meme image that got circulated recently from Italy, actually, right? So it's not just America, it's Italy. I think people around the world are very resilient and brilliant regardless of ethnicity or gender or country that you live in. And you can see people taking everyday objects and say, hey, we don't have enough equipment, how can we just jerry-rig something? And yes, this isn't the ideal solution, it's not a long-term solution, but it is a solution. Quite frankly, it's better than nothing. It's better than the government's response, right? Okay. So let's take a look again at a realistic graph of kind of how these things happen, right? So here we have typical two-wave response or curve of a virus. And you can see at the very beginning, the idea is that the graph is that we're implementing NPIs and that we're stemming the response of NPIs to keep us kind of below this medical capacity, right? And so in this case, in America's case, we're spending at least $2 trillion. Probably it's going to cost us more than $2 trillion, probably that 2 to 5 range to deal with this. But the question then, as this graph shows, is what happens when the NPIs end, we all come out of our homes, start living again, and this wave hits, right? We're going to have to go through this whole another set of mass isolations, NPIs, because we don't have any drugs or vaccines to to combat this, and we're going to have to spend another 2 to 5 trillion. And quite frankly, that's just not sustainable, right? We can't, every time a low to mild threat virus hits, to go in our holes and hide. It's not feasible for long periods of time. It causes massive economic depression and recessions that have rippling and crippling effects on the people who are surviving this, right? We want people to be in debt for 10 years because of a 2 or 3 month response we have every single year. I mean, that's just a massive amount of debt that keeps piling up, and that'll exponentially sink us and ruin our country and ruin the lives of individuals. So the more pragmatic solution that I'm proposing, and something I think we've traditionally done, is we basically say, okay, whenever a virus hits, again, we shelter our people, we isolate and help the people who are most at risk, and we take the next 2 or 3 months to say, okay, based on the data that we're looking at, because we want to be very data focused and data driven, what is the potential capacity that we need to build? What are the type of equipment that we need to start ramping up before they're impossible to manufacture, so that as the need arises, we're matching or exceeding the amount of equipment and beds needed to match and help people. And so what that means is when the next crisis hits, or when this virus comes back again, we're not stuck with our pants down, having to dive back down into our holes. We're saying, okay, we've done this before, we've learned a lot of lessons, and oh, by the way, learning these lessons on the coronavirus is fantastic because the blast area is so minimal, right? So few people are dying of this, that if we make mistakes along the way in how to build up capacity in our medical system very quickly, not a lot of people are going to suffer because of it. So this is a fantastic learning experience on, okay, what does it take to respond effectively and efficiently and quickly? So this is really what we should be doing. This is what we've been doing for 50 years. Again, why we decided to not do this is absolutely beyond me. Now, what are some counter arguments against this? As you're thinking, you're like, well, this might not always work in all situations, right? So, if the people who are at risk are too large, what if everybody's at risk? What if this is just like a bullet and just knocks everybody out? It doesn't matter. Well, you're right. If it's just too dangerous, or if the number of people who are infected is too big, then our response would be different, right? Which is why you can't really say this is going to be for everything, but any type of pandemic or viral threat similar to corona, similar in that low, mild, moderate risk category, we can treat without NPIs, without mass isolations, right? And just isolate the sick who are in maybe some of the at-risk population, just kind of give them a little bit of a heads up and help them, and we should be able to get through this. Except in dire, the world is literally on fire situations, which is very hard to happen, but it's possible. But this is not one of those situations. Now, another thing I've heard a lot is that, well, we need to do mass isolations and we need to take the economic hit because, listen, it's just your 401k, it's just your stocks, it doesn't matter. But that's not true. It's not just your stocks. These are real people getting hit, right? There's likely hundreds of thousands, if not millions of people who are now out of work because of our response to the coronavirus. Because of these mass isolations, people are out of work. People are losing money. Not just corporations, but people are losing money. Salespeople are losing their bonuses. Small business owners are losing sales. People are getting evicted because they don't have enough money to pay rent. They're trying to figure out how to buy food. Children's graduations are being delayed. Vacations are being put on hold, or at least the savings to be able to go and do something is being put on hold. And so we're having this huge effect on people's lives, right? And we need to be very cognizant of that. And again, it's a balance. It's not saying that money is more important than people, because that's certainly not the case. But we do have to be pragmatic and say, okay, how we deal with this cannot chop our arm, right? We can't to solve the flu. We don't go around chopping our arms off, right? It's okay. We take some medicine. We stay in bed. We're fine, right? We have to take that same type of pragmatic approach to these viruses in the future. Now, the other thing we have to take a look at is say, well, mass isolations, they worked in South Korea and China, right? Well, Not necessarily. Again, we still have to see, well, what happens in a couple months, right? We don't have a vaccine. We don't have drug therapies. So if we don't have those, and maybe we'll find one between now and then, and so we won't ever really truly know what happens if that second wave comes and hits and would have decimated China and South Korea after the fact, where the NPIs ended. But we can't look at these other countries who implemented it and say, yeah, they won, and so now we're going to do the same thing, because it's just too soon to be able to make that determination. And kind of getting back to that, this ethical, philosophical idea of, all lives are worth saving, that train problem of, this train's on track to kill 5 people. Do you switch it so you only kill 1? What do you do here? Well, again, I think it's a fairly easy problem to solve. I don't think that train problem is actually that difficult, because a lot of our inaction on a daily basis kills people, and we don't really think about that we're okay with certain amounts of inaction as an individual or society killing people, but that's what happens every single day. And so now we have this ability to say, okay, well, now my hand's actually on the trigger. I have to make a decision. I just can't be, lazy and thoughtless and just let things happen. I have to be part of society and use my brain. Well, what am I going to do? Well, you have to think. You say, okay, well, viruses happen. We can't control the weather. We can't control every virus. We can't control how nature does things and the natural evolution of life. And so these viruses are going to come in, and sadly, they're going to kill people. We have things like cancer already that are killing us, and it's very sad. But we can't overreact to the reality around us. And I think part of it is just people feeling very sad about reality, not wanting to deal with the idea of death, and so acting very irrationally in response to their inability and emotional fragileness. Right? And speaking kind of along those lines of inaction, if you look at how our organ donor system works currently, how triage and hospitals work currently, it's all about prioritizing those in the most need, right? There's an organ donor list, right? Say for a new pair of lungs. Well, if you're 80, the chances of you getting a new pair of lungs is slim to none compared to the 21-year-old who is in need of a new pair of lungs, right? So we're already making these decisions. So this is really just kind of an extension of saying, yeah, we have to do what's best for society, and unfortunately, some people aren't going to make it, right? And we think we need to do everything that we reasonably can to help the people who are at risk, but we can't be sacrificing the people who would normally survive and make it through this fine, and say, well, sorry, you've got to chop off an arm because this person who's probably going to die in 6 months anyways is going to die now, right? It just none of this is really logical. And in terms of economic effects, we have to say, look, what happens if we do these NPIs, these mass isolations, and we have a Great Depression or a Great Recession? Is that something that we really want to deal with? And once we're in that, that's going to be a lot harder to get out of than it would be just dealing with this viral situation pragmatically. Okay, so those counterpoints aside, I think we've kind of dealt with those and seen that those really aren't good reasons to go for NPIs, or not to take a more pragmatic look. Why might our politicians have chosen mass isolations? And the first thing is, around financials, is they probably thought that, maybe things would rebound a lot quickly. They figured that it wouldn't be that much of a hit to the average people, because what can we do? Well, we can just pass a $2 trillion stimulus, the biggest stimulus package in the history of America, right? And hey, I'm president. Hey, I'm in Congress. You know what? The debt, the national debt, that's the next guy's problem. I don't care. I want to get reelected. That's the purpose of my job as a politician, is reelection. So what do I care what the debt is? I'm just going to balloon this sucker and let the next guy deal with it. I'm making millions. I've got 3 or 4 houses. I live in Martha's Vineyard. Who cares? Right, so that's part of the reason, is they knew that there would be an eventual government bailout that would help ease the burden of the financial crisis. So that would just kick that can down the road, so to speak. The second one is the fear of being wrong. Right, as a politician, your job is to get reelected, and you don't want the news media, you don't want your political opponent in that next election cycle to point to you in their ads and say, listen, This guy killed tens of thousands or hundreds of thousands of people who didn't have to die. Vote for me, I'll take care of you. I mean, that's a dangerous, difficult message to have to bounce back from as a politician. And the second one is incomplete data, right? Chances are these scientists, these advisors who are talking to Trump, they're like, hey man, I don't want to lose my job by saying something that's going to get him fired or get me fired. So I'm probably going to be dealing with the worst case scenarios. I'm going to give him some worst case scenarios because, quite frankly, I don't really know how this thing's going to shake out, right? A lot of people probably haven't dealt with these type of real world, non-computer simulated, non-computer modeled situations before, and they're just making best guesses. Right? And these are academics, so generally the scientists, I mean, they're all about the science, right? They get really super nerd. It's about medical nerds, right? And these medical nerds are just about the purity, right? The purity of the medical science. And so they're always going to err on the side of the purity in the response rather than a pragmatic solution. And finally, there could just be information out there that the public just doesn't know about, right? They could have some really gnarly information on how these things go, and that would have informed their response in a very specific way. All right, so kind of with all that background, how did we get here? What were kind of the series of events, not just timeline-wise, but major moments in time that got us to the point of mass isolations? And the first one being the CDC guidelines on reducing gathering sizes, right? They're basically saying, hey, we have to have less than 300 people in an event at one time. And so all the governors and state legislatures responded in kind, saying, whoa, well, hey, if we can't have 300 or more, then we got to cancel our sporting events. We got to cancel bars and clubs and work and restaurants and malls and concerts, right? And it's logical. I mean, it's not an illogical response that governors had, right? They're following CDC guidelines, and so are corporations of saying, okay, I don't want to be at risk either politically or legally for putting people's lives in danger if we're not following the CDC rules, right? So that was basically the first thing, is the CDC basically sunk the ship, and we just kind of all went down with it. So really, the governors aren't to blame. And then we had this massive media blitz on flattening the curve, right? Everybody, bought into it, hook, line, and sinker. Flattening the curve, mass isolations are the only way to go. People focusing on total infections and this and that, and how quickly it's spreading, and that really wasn't the important data, and people kind of got that data wrong and made a lot of wrong assumptions, especially when you started hearing the phrases, look at what's happening in Italy, look what's happening in South Korea, right? Italy was having this massive surge in death. 8% of people were dying. Oh my God, we can't have 8% of Americans dying. This is insane, right? And everybody kept saying, look at Italy, look at Italy. We're just a couple weeks behind Italy. We're going to be right there with them. Look at Italy, right? Well, Italy is a terrible example to use for the United States, right? I mean, yes, the infectious rate might have been 2 weeks behind Italy, but that doesn't mean our response and how we deal with it and our death rate is going to be anywhere close to Italy, because the demographics are so vastly different. Italy has a huge number of people that are elderly, 70 plus, and a huge number of people in the hundreds. And they live in these multifamily generations stacked on top of each other. I mean, it's just such a different world than what the majority of Americans, even in big cities, face. And, in South Korea, again, yes, they implemented these drive-through testings really quickly, but they were just kind of more like temperature tests, right? There were these kind of, half-hearted tests that made it seem like they were doing things, but that the test results were maybe only like 50% reliable. So again, South Korea wasn't really that good of a someone to look to, but we used South Korea and Italy as reasons to justify these isolations, along with this flattening the curve narrative that wasn't true, and these CDC guidelines that led to just a domino effect of governors closing off their states and cities. So with that, how do we get out? What's the solution? What's going to get us out? Well, the first thing we need is pharmaceuticals, right? Anything short of pharmaceuticals is we're just playing this game until we get something that works, right? And so that's probably not going to happen for a long time, short of maybe drug therapies with existing things that helped mitigate SARS back in the day, or currently with malaria. If some of those drugs, those could potentially provide political cover for our politicians and bureaucrats to start ending the mass isolations, because that's really what it's about. There really aren't any good valid reasons that I've found to continue with mass isolations, but the problem is once you start them, how do you get out of it? And how do you have a defensible reason to get out of mass isolations? What can you come and tell the media? What can you tell your voters, your constituents, on why you're ending these mass isolations? Because you don't want to get fired from your job, right? So a pharmaceutical cover would be the best cover. That's going to be difficult, unless there's hydroxyden chlorine, forget how it's said. If you use that, that might help kind of stem and mitigate some of it. But those drug therapies are not yet proven; they're still in test, and that's only a 50-50 that really helps us out. Medical capacity, right? If the hospitals we're building ends up being more, and the masks and ventilators we're providing end up being much greater than the hospitalizations we start seeing coming through, right? So if things are leveling off and we're staying below the difference between the number of beds and the number of people who need beds, that's a good data point for politicians to use to say, okay, we don't need to continue with these mass isolations. We have a pathway out, right? And I think also with those data points, the death rate's going to help a lot, right? The death rate's going to say, okay, the more testing we do, even though that's really not going to help us that much. I mean, it's always good to have that data, and that will definitely help us. And the more data, the better, right? But as we get more people tested, the death rate's going to plummet, because right now the only people getting tested are people who are basically already hospitalized, and potentially knowing that they have COVID-19 is going to somehow change the current therapy plan that they're on in getting better, right? So only like the worst of the worst are getting tested, and that's why our current death rate at hovering about 1.2% for the past week will likely drop to 0.7% or even lower once more and more people start testing, right? Because if we get hundreds of millions of people testing, those that are positive are generally going to be healthy, and our death rate's just going to go, and that'll be a good reason for politicians to say, okay, we can get out of this. And hopefully with that, then that means the CDC can then change their guidelines to say, okay, we think as a medical community, based on our modeling or whatever excuse they want to use, that more people can be gathering in groups of 500 or 300 or whatever, and that'll give governors the ability to, and companies, to say, okay, come back to work, okay, get out of your house, we're going to be fine. Okay, so with that, probably in a couple months, somewhere around May-ish, the number of cases will likely level off, and that means that, again, the governors will be able to say, okay, because we're having a leveling off of cases, we can start coming out of mass isolations. And the one thing that's never going to happen would be riots in the street, right? People finally get fed up with staying at home, dealing with this, third or second world living environment, because that's what we're kind of in, right? We're basically living in the communist version of America. Lines at the grocery stores, you can't get everything you want. The police will arrest you and throw you in jail and take your money away if you leave your house. I mean, really draconian tactics, right? That we're having to deal with, and we're saying, oh my gosh, like, how did we get here? This is such a horrible place to be. We need to make sure we never come here again, right? And just if you're into wondering and predictions on how long it's going to take us to get out of this, if you're looking at how fast we fell down, generally the economy is not gonna increase at the same rate that it decreased, right? So assume a slower recovery than the quick decline we've experienced the last couple of weeks here. All right. So here's probably maybe a really important takeaway too, is what can you do about this, right? You're experiencing this, you're frustrated, you're mad that from all this research, NPIs aren't working, but we're doing them and we're losing money, or our quality of life has dipped significantly. We're probably not saving that many lives anyways, because our medical response has been so fast, we've been able to respond so quickly within a week that we probably could have done without mass isolations and had a very similar response without trillions of dollars in debt. So again, the first thing you do is, again, apply these first principles of breaking things down into their smallest components and building your knowledge up so that you're able to inform yourself and create a unique worldview. So when a crisis or something happens in the future, you can be caught up and have a really good idea on how you need to personally deal with it. The second is you need to assume that the media is not there to inform you. The media is not there to sell television. The media is there to sell ads, whether that's internet companies like Google and Facebook and Twitter, or these giant media monoliths like Viacom and Comcast, or publication syndicates like Gannett and Condé Nast. Their goal is to sell ads. That's how they make money, by selling ads, right? So anything they can do to generate more readership, that's what they're going to do. And their goal isn't to present you with the most truthful, informed, unbiased narrative. Their goal is to sell ads. So just kind of keep that in mind as you're reading everything. Take a critical look. It's not saying that they're all bad or they're all evil, because I'm sure there's a majority of them probably go in with the best intentions, and things kind of get off rails, and you get a culture within a company that's focused on a certain thing and that permeates all ranks, and you just kind of go sideways, right? So I'm not saying that the people are bad. It's just kind of the culture that's been created within these media companies. And something that might come across as a little bit extreme, but I think is probably necessary, is we have to demand that the people who are in charge, that we hold their feet to the fire, right? Tribunals. It's probably not too extreme to say Nuremberg-like trials for these people, right? We need to have better transparency and demand better transparency from our government officials on what they're doing and why they're doing it and how they're doing it, right? When we had plans in place 15 years ago, they're supposed to help us deal with these crises, but the politicians elected, the bureaucrats unelected, are the ones who dropped the ball and have left us in such a vulnerable state. And it's criminal, and they need to be held accountable, right? Governors, Congress members, presidents, sitting and non-sitting, elected and non-elected, all these people need to be held accountable for the situation that we're in. Media executives, right? They need to be held accountable. And it might sound crazy, but doctors, right? Doctors aren't these mysterious, smart, magical alien beings. You look at a software programmer that has a PhD in computing, and you look at a doctor with a PhD, listen, they're both nerds. They're both people who are bookworms who put their nose to the grindstone, spend about 8-10 years focused on learning a thing, and now they're getting paid vast sums of money to do it, right? That doesn't mean they're the smartest people in the room. That just means they're nerds about a very specific topic, right? And these doctors that went into leadership and became administrators need to be held accountable for not properly preparing us and not presenting us with a real, complete view of what's happening, and making sure that our medical system has the capacity and capability to respond to crises in an effective and efficient manner. And they are absolutely at fault, and we should be mad at the WHO, we should be mad at the CDC, we should be mad at HHS, Health and Human Services, for leaving us in this predicament and leaving us unprepared. Right? This isn't the average American's fault. This is a fault in leadership 100%, and they need to be held accountable. And finally, last but not least, you need to prepare yourself. That means that you need to make sure you have probably a month or two of rations of food and supplies available for you. You want to be able to make sure that you can protect you and your family. You want to make sure that if the water goes out, or the electricity goes out, or the internet goes out, you're prepared to weather that storm for probably 3 to 6 months, so that as the government kind of gets itself back on firm footing and figures out how to deal with this, that you and your family are not left in a very vulnerable predicament where you might be at risk of dying. All right, so protect yourself, and as new laws come down the pipe, make sure that you're voting for people who are preserving your liberty and freedom to protect and plan for a crisis, for governments that overstep, for bureaucrats that overstep, so that you can keep yourself and your family safe. All right, so in the end, just chill out. Don't worry about a thing. You'll be fine. We'll make it through this. But make sure you have an understanding of how we got into this, why we got into this, the failure of our elected and unelected leaders in government to react properly, causing an overreaction in the media, which caused a panic in the general population, all from mass legislation that didn't need to happen. All right. Well, so thank you for joining us and joining me today in this episode. And until next time.